Liz, and up there, Mo, fast asleep. I thought I would do you an update on my gastro stuff because it's been a while, and obviously last time was before I went to see my gastro doctor for my results of my tests. As you can see, it's a lovely sunny day today. It's Halloween. I'm doing a couple of videos today. So this will not be on Halloween, but this will be probably a couple of days after Halloween. So basically, I'm sorry, the lighting is a little bit bright. I'll try and angle it for you so it's not so bad. There we go. So basically last Friday, so a week, is it a week? We're coming up to 2 weeks since I went to see my gastro doctor, and I didn't really want to do a video about it straight away because I was so frustrated and upset with like my appointment, and I just was like, I just want to like not talk about it. So a disclaimer is that this is literally just my experience of this doctor and the hospital, and you know, I have 3 friends who see him, 2 of which are on TPN and 1 I think is on like a Peg J, I think. But nevertheless, he was recommended to me because he's very, very knowledgeable on EDS, gastroparesis, and just gastro issues with EDS. And as I mentioned in my previous videos, when I first went to see him, he basically said that he was like, oh, I said, you know, finally, it's good to meet you, to find someone a gastro doctor who knows what EDS is. And he was like, well, we don't know any link between EDS and gastro stuff, really. And I'm thinking, what? Like, hello, are you the right doctor? And he was, and he was very, very quick trying to get me out of the room. He didn't know any of he hadn't looked at any of my history. He tried to put me on a medication I'm allergic to. He didn't offer any advice or anything because he's like, oh, well, you're under so many people and, you know, it's all in your head kind of thing. I went with my mum when I went to see him a couple of weeks ago, and obviously I'd gone to get my results from my biopsies, my endoscopy, my colonoscopy, my hydrogen breath test I already knew was negative, the blood tests, and to see what the plan would be going forward because I'm not really any better. I still get pain when I eat anything solid or fairly solid. I also have diarrhea all the time despite coming down off my stomach meds that stop me being constipated. He told me to come off on half a dose. So instead of having 2 milligrams a day, went down to 1. And then for 4 days, I was in so much pain and bloated, and I couldn't cope. It was more pain than when I have the pain when I get diarrhea. So I was like, I have to go back on my normal dose of it's prucalopride that I take. So, God, this light. I need to go in a dark cupboard. So yeah, so basically, I tried what he said and that didn't help. And basically, he said my blood test results were all fine. My biopsies were all fine except my colonoscopy. There was inflammation that if they hadn't had a camera, they would have said it was Crohn's because the inflammation was quite high. But because the camera didn't see Crohn's in my intestines and bowel and whatnot, colon, and I watched the colonoscopy on the screen, there was no like ulcers or what I've looked on the internet for what Crohn's and IBD looks like. It didn't look like that. It was just red. He said, oh, it could be an indication of Crohn's, but it's not. And I'm like, well, it's just really weird, like how they've just swept that under the carpet. Like, yes, you've got inflammation in your bowel, but you have irritable bowel syndrome, which I've had for years. So it's like, I don't understand that at all. So Anyway, so obviously we were like, right, so what's wrong with me? Because no one can tell me. None of the test results are showing anything. It was a relief. It wasn't anything serious. I am glad it wasn't like Crohn's or IBD, or cancer or anything really horrible. But at the same time, I need answers still. And my mum is good because that day that we went was 2 days after I started getting the horrific side effects of the flu jab that I did the video on. If you haven't seen that, go back and watch that. I'm still having side effects from it, like the pain in my neck and my head and my back is horrible. So I was like a zombie that day. So my mum was like, well, what's the plan? And he goes, well, he was like, tests aren't really useful. They can be a false negative or a false positive, and having all these tests isn't really going to help. And I'm thinking, hang on a second, having these tests means that it's ruled out serious stuff. So tests are helpful. And in the past, I've been diagnosed with POTS from tests. I've been diagnosed with EDS from, not technically tests, but it's ruled out serious forms of EDS. So tests aren't useless. And he really wouldn't budge. He really wouldn't. It's Dr. Woodward. I didn't say that. I forgot. That's why I had the disclaimer. Dr. Woodward at Adam Brooks Hospital in Cambridge. As you know, I saw Professor Aziz several months ago, and when I said it was Dr. Woodward I was seeing, he knows him, and he was like, oh, he's a great doctor, but he specialises in intestinal failure, and obviously I don't have intestinal failure as far as I'm aware, because the people I know he sees, who are friends of mine, have intestinal failure. Those are the ones that are on TPN. And I've got this really weird feeling that he's very sizist. Like, he expects, like, he will only treat me if I lose like 10 stone and I'm skeletal and I can't move, can't speak. Literally, I would be the worst possible, like vomiting everywhere and everything. The thing with my problem at the moment is I'm not vomiting. I'm feeling sick a lot, but there's no vomiting. Sorry, I'm looking at the wrong place. The camera's over here. I'm not vomiting. I have loads of diarrhea all the time. When I don't have my tablets, I get completely blocked up. If I have even, like, get the dose right, my stools are never solid. And then they're like, well, you need to eat more fibre. I'm like, well, I can't because it hurts my stomach. And then I started getting bleeding from my bowels. And obviously that was after the colonoscopy. So they've already checked for anything that could be like bleeding, serious stuff. But I don't have any of the results, so I'm going to ask the Freedom of Information Act that you can ask the hospital for your results, a copy of them, like blood tests and all that, and the biopsy results, because I want to see for myself, and I want to have them because I've got a feeling that next year I'm going to end up having to go and see Professor Aziz again and pay like over £300 for half an hour, because this doctor, Dr. Woodward, is just a nightmare. We had to, everyone on my gastroparesis support group has said, get a gastric emptying scan, which I had 8 years ago, which is what actually diagnosed my gastroparesis in the first place. So that's what I need. And I asked him and he said, oh, well, tests, blah, 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 about tests and how they don't help and how it wouldn't help. It's like, look, I want this scan. Please, can I have it? And so he's arranged it. And there's not a long waiting time. In fact, I have it in 2 weeks' time. And then he's like, well, I'll definitely see you before Christmas with the results, etc., etc. And then I got a letter through the other day saying that my appointment with him is the 25th of January. So I'm just like, do you know what? I want to see a different gastro doctor. I can't actually change that because your GP has to re-refer you and you have to go to a different doctor that way. That takes too long, but I'll certainly phone up his secretary and say, is there an appointment sooner after my scan? You pretty much get, I remember from before, you get the results the same day. Like, they'll tell you how much percentage of food's left in your stomach, but in the letter about the scan, it's like, we are going to scan you and you're going to be in the department I can't speak today, for 5 hours and you can't leave. And I'm thinking, I can't sit in my chair 5 hours. Like, it's adapted for me, but it hurts so much to sit for that long. And obviously I know a lot of people who've had gastrochemistry scans who've been mobile or not mobile, and they always blame the fact you're sitting still and not moving for the food not going down. They might say, they said to one of my friends, "Oh, you need to go for a walk to try and get the food moving." It's like, well, that's not an option for me because I can't stand up and walk because my Potsie is so bad at the moment. I faint and my joints are so bad I'm going to fall over. So there's all that. And then it says we're going to give you egg white, toast and jam, and they're going to put the radioactive stuff in the jam to eat. And I was like, well, the reason I'm having this is I'm having pain eating. I've got gastroparesis, blah, blah, blah. The egg white you're not allowed because I'm on a low histamine diet, and egg white is banned because egg white is high in histamine. And I have gluten intolerant, so I can't have their bread unless they have gluten-free, which they don't. And I don't eat jam because the sugar's so high. And I also follow the low FODMAP because my dietitian is like on me for about that, which I've been on before anyway. So I was like, look, I can't. So I phoned them up, and actually they were really good. And they said, bring your own food, something similar consistency. So I'm going to make some mashed potato the night before, dairy free. I'm going to take a piece of gluten-free bread, and I don't know, I'm just going to have jam, I think. Or I don't know whether I can get some of that, what's it called? Freedom. It's dairy-free chocolate spread. Because they could put stuff in that, and that'd be alright. Oh, there's a bit of a break in that. I've changed position, and it's no longer that sunny. And I have a blanket on me, because just as I was finishing telling you about the thing for the scan, the bed came. So luckily we'd paid extra to get them to set all the bed up and take all the rubbish away. So we now have a new bed. Woo! And it's very comfy. So anyway, as I was saying, the reason I'm going to force myself to have the toast, even though I know I'm going to get a lot of pain from it and probably feel really ill from it, is because they need something solid to prove that my stomach is not digesting stuff. I have gastroparesis anyway, but it's definitely got worse, and to what extent is what I want to know. And so I know a lot of people who've had the scans have been told you've got to walk around, you've got to, sit still, your food's not going to digest very well, but I don't know what they're going to say to me, because it's not like I can walk around because my Potsie is so bad at the moment. I'm still recovering from the flu vaccine that things won't move much. And then they'll probably just say, oh, well, the whole reason for this in the first place is you're not moving much. But this problem started back in June. June, this is nearly 6 months. This is coming up to 5 months. Crazy, isn't it? So I can't remember if I've said this yet, but yeah, so as I told you, my gastro said, I'll see you before Christmas to get the results. Letter comes through the other day for the 25th of January. So I don't know why. Maybe he just didn't have any appointments before then. But I know that I'm going to face Christmas, not suddenly getting better or anything. But I'm going to face Christmas just miserable because everyone gets together, has a social thing, goes out for meals, Christmas dinner, all that. I'm not going to have to do. Psychologically, it gets to you too. So, yeah, it's really hard. But yeah, he had literally, thinking about it when I went in, I was there for the results of my tests and stuff. But actually, it was the A&E doctor that I saw when I was so bad. He'd arranged all the tests that I'd had and gone to get the results for. My dietitian is the one that put me on the supplement drinks and actually took me seriously. So I do think he has an issue with my weight. And I am they're called GP gainers, where you have gastroparesis, but you don't lose weight easily, or you gain weight without any reason. And it's not just the starvation mode, but your stomach just holds on to everything. And, well, it's partly starvation mode. It's so if you don't eat for a long period of time, or you only eat small amounts, then your body goes into starvation mode where you can't eat, and it protects itself by not knowing if it's going to get food again. So every bit of food you eat turns into fat when you eat it and not burn off. So you just end up gaining weight rather than losing weight. That's what I've gathered from it anyway. So yeah, it was really crazy because at the end of the appointment, my mum was like, so when do we next see you? He goes, do you want to see me again? I'm thinking, well, actually I don't, but like, of course, because I need the results from my scan. Like, I really want to see a different gastro doctor, and obviously Professor Aziz is my option for private, but I'm just so frustrated that I stopped seeing my London doctors at UCH, and just because it was just so far to go to for one appointment and expensive and everything else. But I can get patient transport. But it's just, I'm just so annoyed. When I first started going to Addenbrooke's, the gastro doctors were really good. They're the ones that just got me on prucalopride because all other meds I'd tried hadn't worked. So I don't understand why now I'm seeing supposedly the best doctor for EDS and gastroparesis, and he's not helping. He's like, oh, we may never know. I have some patients that are far worse than you. Like, when I said I was able to eat scrambled egg and mashed potato occasionally, and this is only occasionally, not every day, he goes, well, that's much better than most of my patients. I think it's not a competition. And also, he said that, you know, you could be worse. And I'm thinking, well, yeah, he's obviously referring to the fact that I could be, like, skeletal, malnourished. I really don't understand. So this afternoon I'm going to phone up to try and get hold of a copy of all my results, so that I can have them to take to someone randomly walking past my window, to take them to either Professor Aziz if I have to, or a different doctor, or just to look at them myself. I really don't believe that every single result was fine. And this thing he said about there being inflammation markers in my bowel, but yet there's no diagnosis of anything, it just really strikes me as weird. So anyway, that's where I'm at. Diet wise, I've gone off scrambled egg. I really don't like it anymore. So I'm really down to mashed potato, gluten-free, fish fingers sometimes are okay. Sometimes I manage, they're like lentil chips by Eat Real. And that's it. And then my elemental drinks. It's a fun life. Woohoo! Actually, no, in butternut squash, I'm trying to get my vegetables. It's really, really nice. And having it as a mash. So everything's just mash. Everything's puree. I noticed the other day how much, like, my diet has changed because all the bowls in our house, the food bowls, get used up within like 2 days because it's all me having like my purees, my mashes, and then we have tons of dinner plates left over because it's only my husband who is eating a full meal. I haven't had a proper full meal for, well, since June, so that's my fun life. I shall give you an update. The scan is on the 16th of November, the gastric emptying scan, so I'll do another update on my gastro issues and how that was after then. So yeah, I'll speak to you then. Bye. Thanks for watching, everyone. Stay tuned and click the picture of me on the screen right now, and you can subscribe to my channel. Please like the video and click the bell notification if you want to know when my next videos are put onto YouTube. There should be a box on the screen where you can see other videos I've done. Happy watching!